Hello, and my name is Vin Kalathavidal. Today I am joined by Professor Roopen Arya from King's Thrombosis Center in London, England. Thank you so much for joining me today.
My pleasure.
Really look forward to speaking a little bit around World Thrombosis Day, which is coming up in October. How long have you been a partner with World Thrombosis Day?
Well, we've partnered with World Thrombosis Day since the outset, because for many years I've been involved in leadership of the National Venous Thromboembolism Prevention Program in England, and I direct a national exemplar centers network of centers of excellence in VT prevention and care, and our aims and aspirations are entirely aligned with those of the World Thrombosis Day campaign.
And you mentioned since the onset. So how did you actually first learn of the campaign?
Well, I learned from leaders in the field and colleagues who've been involved in World Thrombosis Day, and of course, the very widely circulated publications in many peer-reviewed journals about World Thrombosis Day. And WTD also has a very active media campaign and social media campaign, which I'm very aware of.
Why are you passionate about thrombosis awareness and prevention?
First and foremost, I think we've realized over the years that it's the right thing to do for the patient, because we've been increasingly aware of the burden of disease due to hospital-associated thrombosis, and why preventing VTE is a top patient safety priority in our hospitals.
Can you share an example that you've been a part of, an event or an activity in which you organized for World Thrombosis Day?
Yes, in fact, to coincide with the first World Thrombosis Day, we held a large celebration of the 10th anniversary of the National Exemplar Center Network. And we highlighted the very important work being done both locally and nationally to prevent hospital-associated thrombosis. And more recently, just last year, and kind of reaching further abroad, we organized webinars targeting healthcare professionals in India to share our experience of preventing hospital-associated thrombosis and to try and educate multi-professional audience about the dangers of venous thromboembolism and about implementing programs to prevent hospital-associated thrombosis. And in fact, in that webinar series, we reached over 3,000 people in just 2 webinars.
In 2 webinars, wow. Yeah. As a clinician, how do you educate your patients about thrombosis?
I think most commonly it's a face-to-face interaction in clinic where we kind of discuss the issues to do with thrombosis with the patient. Usually it's a patient who's already had a blood clot, though it could equally be on the wards where we have an extensive program to prevent blood clots, and we have patient information leaflets to inform the patients about the measures and why it's important to prevent the blood clots. And also we have, with time, realized the importance of patient stories. For example, the National VT Prevention Program in England has done videos that were posted on the NHS website. An example of that is a patient story from Paul Robinson, who was a very famous England soccer goalkeeper, who unfortunately had a pulmonary embolism after he had back surgery. So he shared his experience of venous thromboembolism, which I think patient stories are very compelling. And lastly, we've also created educational modules targeted both at healthcare professionals and at patients within the Health Education England website, which are also very powerful means of communication. And I think the work of both Thrombosis UK and the World Thrombosis Day in generating patient-directed materials, the content of the websites is very, very important. Yeah.
What's your advice for someone that wants to get involved in World Thrombosis Day?
Well, I think the easy bit of advice would be to look at the World Thrombosis Day website, which is worldthrombosisday.org, and it kind of directs you to the relevant individuals and what kind of activities you can get involved in.
Do you have any closing remarks that you'd like to share with anyone?
Well, I would like to congratulate World Thrombosis Day for its splendid efforts in helping to prevent what in most cases is a potentially preventable complication of hospitalization. Really, and I've found it very valuable to be able to share my experience of the National VT Prevention Program in England, and in which we have for the first time been able to demonstrate an improvement in patient outcomes. That we have shown that through the efforts of risk assessing all the patients and giving them prophylaxis as appropriate, that we've managed to reduce post-discharge VT deaths by 15%, which I think has been a huge achievement.
Thank you for sharing that personal connection that you have and the impact specifically in England. Your involvement with World Thrombosis Day, we look forward to continuing to hear more successful stories over the course of the next couple of months leading into October. And thank you again for watching this very important episode on World Thrombosis Day.